Welcome back, everyone. Today we're going to be we're doing a deep dive on a case that should remind us all, even when you're really busy, to keep a wide view, diagnostically speaking, of course.
Yeah, for sure.
This case is about a middle-aged woman. She's got a history of type 1 diabetes and also rheumatoid arthritis.
Yeah.
And came in with, left flank pain, fatigue, nausea, weight loss, weakness. Sounds pretty
Straightforward.
yeah, like something we see all the time.
Totally. At first glance, it does seem like a UTI, especially since she's also got a non-obstructive kidney stone and has some signs of sepsis.
Oh, wow. So like elevated CRP and leukocytosis?
Exactly.
Dysuria, blood in the urine, nitrites positive. So she's got diabetes in her history. You would think an EKG would be like,
Automatic.
yeah, but it wasn't ordered right away. So what happened?
Well, the team, which they were totally right to do, jumped right into treating what seemed like sepsis. So they gave her IV fluids, antibiotics, pain management, the whole 9 yards. But an EKG was sort of forgotten at first.
Oh, wow. Looking back, there was a potassium level of 5.8, but it was from a hemolyzed sample.
Right.
That should have been like,
A big red flag.
yeah, like a huge warning sign.
Yeah, a potassium level that high, even if the sample is hemolyzed, you really need to get an EKG. But unfortunately, it didn't happen right away.
So when they finally got the EKG, what did it show?
The EKG was like from a textbook. You can have a look.
Wow, look at those inferior leads. That's a STEMI, an inferior STEMI.
And look at the bedside echo, especially septum. So needed immediate transfer for a PCI.
It's pretty scary how easily something as serious as a STEMI could be missed. How do we make sure something like this doesn't happen, when we're practicing?
I think this case is a really good example of how dangerous it can be to get stuck on one diagnosis. It's what we call diagnostic anchoring. You zero in on the most obvious explanation and potentially miss other possibilities. This kind of cognitive bias, it can affect even, the most seasoned clinician.
For sure. Is there anything we can do to sort of combat that bias?
Definitely. For one thing, you got to actively consider other diagnoses. Even if a patient's symptoms seem really straightforward, especially if they have a complicated medical history like this lady, take a minute, think about other things it could be. Also, using some kind of structured decision-making tools like algorithms, checklists, things like that can help make sure you're not skipping important steps.
Yeah, that's really good advice. It also shows how important it is to think about how things present differently, especially in women and elderly patients.
Yeah, absolutely. The classic presentation of an MI, that crushing chest pain, it isn't always what you see, especially in those groups. You got to remember that. Silent MIs, they're more common than you'd think.
Really emphasizes how vital a baseline EKG is for any patient who's not doing well, especially if they have diabetes.
Couldn't agree more. It's such a simple test, but can give you crucial information, and it could even prevent something really bad from happening.
So with this case, what seemed like a normal case of maybe a UTI in a diabetic patient actually hid STEMI.
Exactly, and that's the main point here. Patients can have multiple things going on at the same time. You can't just think about one thing. You have to be able to think in multiple dimensions. Always go for a really thorough evaluation.
So to wrap things up, do you have any final thoughts for our listeners?
I'd say stay sharp, question what you think you know, and never underestimate how complex the human body is. What other subtle signs might we be missing in cases that seem totally routine? That's something we all should be thinking about.
Absolutely. Really makes you think.
It does.
Well, thanks for joining me on this deep dive.
Always a pleasure.
And to everyone listening, thanks for tuning in. Until next time, take care.